my name is Keanu Langroudi, and today I'll be presenting on public trust in the CDC among racial and ethnic communities in the United States. So, for a little bit of a self-introduction, I'm a rising senior at Calabasas High School. I'm a resident in Calabasas, California, and I'm involved in Model United Nations, the City of Calabasas Mayor's Youth Council, Metro Youth Council, and I intern at clinics in the greater Los Angeles area. I'm interested in the field of global health, and more specifically in understanding health disparities, improving public trust in health institutions, and exploring how policy and communication impact healthcare access across diverse communities. So, my research question was, what drives mistrust in the CDC among different racial and ethnic groups in the United States? So, the purpose of my research was to examine how mistrust in the CDC is shaped among patients actively receiving care, focusing on the demographics, medical experiences, and historical awareness. This fills a research gap by providing insights to improve public trust among diverse patient populations. My research was based on two foundational sources. The first one being Pollard and Davis, which stated that public trust in federal government agencies has never been as important as it has been during the COVID-19 pandemic. Yet, public suspicions of scientific experts and levels of distrust of government institutions are increasing. A little bit about Pollard and Davis's research was that their population size was over 2,000 US adults that were surveyed in May of 2020, with 1,892 of them resurveyed in October 2020. The instruments they used were longitudinal surveys, and the results that they found were that CDC trust declined overall, and political affiliation influenced trust. The second foundational source I based my research on was Boulware et al., which stated that African Americans were significantly less trusting than whites of their physicians, hospitals, and health insurance plans. So a little bit about this source is that the population they used was 954 United States adults that were surveyed via telephone. So the instruments they used was the questionnaire measuring trust in physicians, hospitals, and health plans. Some of the results included that black respondents reported lower trust than white respondents. Racial disparities linked to historical and systemic inequalities, as well as trust, varied by healthcare institution type. The gap in the research that I'm addressing is public trust in the CDC among patients who are actively undergoing medical care. So, this led me to create three hypotheses, which included that respondents of color will have higher levels of mistrust of healthcare professionals and organizations. Secondly, African American respondents currently receiving medical care are expected to have the highest levels of mistrust toward healthcare professionals and organizations. Lastly, given the significant historical events relating to the medical malpractice within the United States, it is hypothesized that there is significant mistrust among patients. So here's my survey that I gave out, and you can see on the left-hand side, this is the first 5 questions of the survey, and on the right-hand side, you can see the Likert scale, with 1 being associated with strongly disagreeing to the statement, and 5 being strongly agreeing. All of these questions are based on the works of Boulware et al., Pollard and Davis, Offit, Allison and Wanamaker, Curran and Harold Joffe, and Cohen. The population that I was able to obtain was 90 responses at patients at doctors' offices across many races and ethnicities you can see in the pie chart. As for the implementation, I gave the survey out to in doctors' offices to patients who were actively receiving care through a QR code scan. So let's go into some history of the topic. So first off, Tuskegee syphilis study. So from 1932 to 1972, the United States government studied syphilis in black men without their consent or treatment, even after a cure was available. The men were misled and told they were receiving free health care. This led to widespread mistrust of major ethical reforms in medical research. Secondly, the COVID-19 pandemic, which started in 2019, caused global disruption and millions of deaths. While vaccines were quickly developed, inconsistent messaging and misinformation hurt public trust in health agencies like the CDC. The pandemic exposed major gaps in preparedness and communication. The CDC's AIDS response was very delayed. In the 1980s, the CDC was slow to respond, partly due to the stigma against affected groups. Activists criticized the government for not acting sooner. This delay severely damaged trust in public health, especially among the marginalized communities. The first graph that I've chose to include in this presentation is based on statement number 4, which says, I trust the CDC to provide accurate medical information on a scale of 1 to 5 with a population size of 90. The blue separates the non-white to the red, white respondents. As you can see, responses were varied, but were at most times quite similar. Here's the second histogram that I chose to include, which is based on statement 9, which says social media influences my trust in the CDC on a scale of 1 to 5 as well, with a population size of 90. But this time, it does not separate race or gender, but as a collective whole. As you can see, the strongly disagree is extremely higher than the rest of the answer choices, nearing almost 40%, as opposed to number 5, which says strongly agree, which is just below 10%. So for the last graph I chose to include, you can see it separates race and trust. So based on statement number 6, I believe that the CDC prioritizes the health of all demographic groups equally. This is based in non-white and white respondents. So you can see that the strongly agree is much, much higher than, let's say, the strongly disagree. So this led me to perform some t-tests. So you can see on the left-hand side the 9 questions from my survey. And then on the right-hand side, you can see the female averages, the male averages, and then the combined p-value. In order for a p-value to be significant, it must be less than 0.05. Unfortunately, the only question that came back significant was number 5, which states, I have followed CDC guidelines for health recommendations in the past. Flu shots, COVID-19 precautions, etc. As you can see, the p-value is 0.0429, making it significant. So, let's go into some key findings in terms of gender. First off, female respondents were more likely than males to believe that the CDC influences are politically driven and inconsistent. Males showed slightly higher trust in the CDC's scientific accuracy and effectiveness, and overall, gender differences were less pronounced than racial differences, but still statistically significant on key trust-related questions. Now, for some key findings in terms of race. Black and Hispanic respondents reported lower trust in the CDC's ability to represent their specific community's health concerns. White respondents were more likely to agree that the CDC prioritizes all demographic groups equally, showing a potential perception gap. There were significant racial disparities in how different groups perceive political influence on the CDC's recommendations. So, for some limitations on my study, included that small and non-representative sample size, as well as self-reported data that may introduce some bias, and that it was a cross-sectional study, which means that the study was only completed one time, and it limited the generalizability across broader U.S. populations because the sample size was limited to only patients within the Southern California region. Here are my references. Thank you for listening, and here are my socials.